my name is Ashley Hogue and this is for BSN 205. I will be demonstrating how to perform ostomy care for my patient. So I'm going to enter the room and provide for patient privacy. I'm going to close the door and the curtain if there is one. I'm going to wash my hands and introduce myself to my patient and explain the procedure. Hi Mrs. Smith, I'm Ashley. I'm going to be your nurse today. I'm going to go ahead and help clean out your ostomy. We're going to empty your bag and put a new one on. Is that okay with you? It is. Okay, perfect. So I've washed my hands. I'm going to put gloves on. And I'm going to start by entering her ostomy bag into another container. So I would have my basin right underneath it. I'm going to open up and get this open to drain any matter. I'm going to make sure that I preserve the clamp. I'll wipe off any of the edges if there's anything left on there. And then I will reapply. Okay, so I've got it nice clamped down and secured. We are going to practice replacing the colostomy bag. So I'm going to use an alcohol pad to remove the adhesive. Okay, so Mrs. Smith, I'm just going to gently kind of wipe to release the adhesive all the way around the ostomy site. I'm gently pulling back as it's coming off, and I'm holding onto the skin so that I'm not pulling on her skin or irritating the ostomy site at all. Okay. Once I've removed it, I will place it into another bag and dispose of it. For the sake of the video, since I don't have another fresh bag, we're going to be using this one to place as well. So I've removed it, placed it in the garbage. Now I'm going to assess the ostomy site and then cleanse her skin as well. So I'm looking for any redness, any skin breakdown, or anything abnormal about the site. I'm using a wet washcloth with an approved cleanser to clean this area around the ostomy, being gentle but making sure I get everything off the area. I would also wipe down if there was anything oozing out of the site and make sure that I'm cleansing it so that there's nothing left on her skin that would cause skin breakdown. Okay, so I've got everything cleansed, and now while that's kind of drying, I'm going to measure the stoma and get the site ready for a new bag. So I'm going to measure with my ruler, looking at all the different options. And I did kind of pre-measure, so we know that this one is a good fit for this ostomy. So now I'm going to size the base plate of her ostomy bag, the attachment, around the same shape. We've got the measurement pieces here. I'm gonna double check and make sure I have the proper one. And I'm going to grab my scissors, which are in the drawer in the patient room, so I don't have to leave the patient room. And I'm going to make sure that I cut out the size to match her ostomy. There are some that make it way easier to do. This is not one of them. meanwhile, with my patient, if this is a new ostomy or if she's not familiar with the process, I would also be providing patient education at the same time and explaining to her what it is that I'm doing. So we can see now this will fit onto her ostomy site. Before I do that, I've already cleansed her skin, but now I'm going to use another clean, dry washcloth and just make sure that the area around her skin is completely dry before I attach the bag. Okay. The recommendation is usually there are different types of bags. Sometimes you will attach this before placing it on the skin, and other times you will attach it last. So I'm going to go ahead and attach the bag because I can still see through it to make sure that I can get it on the site. I'm going to remove the paper and I am going to place this around the site of the ostomy, starting at the base and placing it over. I'm going to gently rub my hands around it and make sure that I'm secure around the ostomy so that there's no leakage onto the skin. Okay. And then once I've checked that it's nice and secure at the base and all the way around the ostomy, then I will remove the plastic backing on the adhesive to further adhere it to the skin. All right. Also going to check that this is clamped and closed so that we don't have any leakage coming out of the fresh bag. Okay. And then before I leave the room, I'm going to ask Mrs. Smith if she has any questions. Make sure that she's comfortable, that there's nothing irritating her skin, that this is placed comfortably for her. I'm going to clean up my area. And now that she's been placed in a comfortable position, I will wash my hands, exit the patient's room, and then I'm going to document the procedure in the patient's chart.